Well, hello everyone, this is Dr. Schroeder with this week's video introduction to week number 4 in our class in the Principles of Healthcare Research. Had a pretty good discussion this week. The discussion, of course, focused on the two articles that we've been reviewing up to this point in the class. The Beck article on the PTSD in post-delivery or delivery trauma, and the Kokava hand massage study. And for the most part, for the class, I think everybody pretty much got the idea and the concept that in a qualitative study, such as the Beck study, that there's not really required to be a hypothesis per se, or a statement of what the researcher thinks is going to be found. Rather, the idea, the point of the research is to just try to find new information and to really explore, and in this case in particular, to explore to see if any more further research is really justified. In the Kokava study, it is a straightforward quantitative study looking to see if there's a causal relationship between hand massage and levels of comfort in hospice patients. And for the most part, everybody picked up on the idea that in a quantitative study where you have that cause and effect, that having a hypothesis and having specific variables is very appropriate. You require that. Was an interesting discussion on the Beck study, though. Distilling it down, several of you had some questions as to, if I can paraphrase it was what the heck's this study about anyway? Why is it important? Is it even really important to nursing? She doesn't really talk about nursing per se in the article itself, so why is this even in a nursing journal? And the answer is that Beck was writing that article specifically for a wide audience, not really just nurses, although it applies pertains primarily to nurses, but really for anybody that's dealing with women who are reporting having experienced post-traumatic stress post-delivery. Kokava does describe that that's a relatively small percentage of the population, and I think some of you inferred that it's like, well, if it's a small, population, is it really insignificant? And in fact, really, sometimes it's those small outlier populations that are ones that we really put the focus on, and that's true anywhere in nursing research. If we're talking about culture, if we're talking about specific diseases or specific incidences, sometimes it's those little outlier populations are the ones where we gain our greatest insights. And that's really what Beck was trying to reach for here. She was seeing what is the lived experience of these women. Is there something here that we can glean? And is there something here that we can look to give us some new understanding about either post-traumatic stress in general or women experiencing delivery in general, or certainly about this particular population? That was really kind of the point of the study. And a qualitative study is always by nature, it's usually much more free-flowing and doesn't always have a definite beginning, middle, and end point as a quantitative study does. This quantitative study follows a very specific formula. You have to develop the methodology, you have to develop the study. Once you develop it, you do the experiment, or you collect the data, and very impartially and without any emotion or opinion at all, go in and interpret what does it mean, what did the numbers say, and the numbers will tell you if something was important or not. In a qualitative study, it's very open-ended. A lot of times the researcher doesn't know what they're getting themselves into, and in this particular case in particular, Beck didn't really have any preconceived notions, or at least didn't state any, about what she thought that was what the related lived experiences were going to be in this particular in the context of this particular study. But it was written for more than just a nursing audience. It was written for any clinician or anybody that would work with this population, which is why I think some of you struggled with the idea that maybe this doesn't have specific pertinence to nursing, or since there wasn't a specific problem stated other than little is known about this population, what's the problem to be addressed? And really what Beck is really asking is, are there any problems that need to be addressed? Can we identify any? If not, we'll let it go, possibly. If there are, let's identify it, let's study it deeper. And that's really the nature of, and very much what you'll see with a lot of qualitative studies. So this week, leading into week 4, you have another discussion question. And this week you're going to be looking at a different study. This is the Aiken et al. Study on hospital nurse staffing and patient mortality. It's a very interesting study. It's one that has actually been widely circulated and widely cited for a variety of reasons, and we'll talk about. And we're going to talk about how do we control for various factors? How do we control variables? And we're going to talk about what procedures, if any, were used to control the subjects and control the study here? Were they appropriate? And we use that as the jumping off point for our talk about research design and rigor in a study. This is um, primarily a quantitative study, so we're going to be talking really primarily about quantitative research methods in this particular week. Of course, your original post is going to be due by Wednesday, with 2 posts to your peers by Saturday. You also have a midterm exam. This is an online exam. It is going to be turned on as of Wednesday. It's going to be available after May 25th. That's Wednesday. It'll be available at 12:01 a.m. Wednesday morning. And it's going to be available all the way through Sunday. If you see different days written in some description within Blackboard, just know that the days that Wednesday through Sunday, they are consistent with the days that are listed in the Sacred Heart University Student Handbook. So that's why they decided that those are going to be the open dates. 25 questions, all multiple choice, and on basic concepts that you should have been studying using any number of using the materials and the quantitative and qualitative statistics terms that we have been discussing. So that will be available at a self-scoring, and you'll be able to see your score right after you answer that test. Any questions, or right after you take the test. Any questions, go ahead and let me know. Or if for some reason you don't see the link, please let me know immediately. I will make sure that you are able to get in and take the exam. The other thing that you need to start this week is the quantitative research critique. This is a critique. It's going to be due next week. I want to warn you, it takes more time than it looks like. It looks almost deceptively easy, because you have a number of criterion points that you're going to be reviewing. You're going to be given an article, or you are given an article that you need to review. Please use only the article that is stated here. And then you're going to be answering the criterion in the quantitative assignment template. Realize that this isn't that you need to go through and actually state your justification for why you found if a particular criterion was or was not available, or was or was not present within the study. It isn't enough to say yes it is or no it isn't, or you really need to state or cite or quote how you found it and where you found it, and in some instances why you feel that your answer was the appropriate one. If you don't do that, you are going to receive a lower score on those criterion points. And this is a big part. This is 25% of your grade, is this particular study. This study, and then the next study that you're going to do, and I believe it's week 7, is going to be do a total of 50% of your grade for those 2 critiques. So it is important that you do are diligent in doing as well a job as you can on those. So it's been a great week of discussion. I look forward to another great week of discussion. As always, if you have any questions about any of the week's contents, about any of the assignments, about any of my feedback, let me know. I will look forward to giving you some feedback, and look forward to seeing you in the class and the discussion questions, and another great week of discussion. See you in class.